Medicare Part D plans can be very different as far as what medications they cover and the prices that your clients will pay. How do you look up that information to find the right plan for your client? Hi, I'm Kendra Chuba, PDP specialist here at Ritter Insurance Marketing. One of the questions I get asked most frequently is how to look up prescription drugs for your clients to determine which Part D plan is right for them. Today, I'm going to show you how to do that. The first thing you want to do is make sure that you get a complete and accurate drug list from your client. We've created this form for you to collect all of that information from your client. It has all the information you need to provide an accurate estimate of cost for their medication. You're going to obtain the drug name, if they're able to take a generic version of it, the format type of the drug, the dosage, the quantity, and how often they take it. Once you have all this information together, you're going to go to Medicare.gov. On the home page, this is what you're going to see every time you go to this page. You want to click on the green button with the magnifying glass that says Find Health and Drug Plans. Go ahead and click on that. As an agent running a quote for your client, you're going to want to use the basic search. To start this, you want to enter your client zip code in the Enter Your Zip Code box. And then click on Find Plans. The next step is going to ask you a few questions. The first two are about how do you get your Medicare coverage and if they get any extra help from Medicare or the state to help cover prescription costs. You can answer these questions accurately or answer I don't know for each of them if you don't happen to know that information right offhand. The last question to ask is if you want to add drugs at this time. We have a full drug list, so yes, we would like to add drugs, and then click Continue to Plan Results. The next step is going to be entering in the name of the drugs. In the search box towards the left side of the page, you want to start entering in the name of the first drug. In this case, it's cyclobenzapine. You'll notice as I start entering in the name of the drug, there's a drop down that appears with autocomplete options. This is especially helpful whenever you have a drug name that's a little difficult to spell. There's a matching result here for cyclobenzaprine HCl. Go ahead and click on that. And then another box is going to pop up. It's going to automatically populate to the most commonly prescribed dosage and quantity of this medication. You want to make sure you have the select dosage, which is 10 milligrams in this case, and they take 3 pills every day, so that would be 90 every month, and they want to pick it up from a retail pharmacy. Click Add Drug and Dosage. And then you can continue typing in the remaining drugs on the list. The next drug is Colchicine. The dosage comes in a capsule or a tablet. You want to make sure to select the correct format. In this case, the client takes the tablet in a 0.6 milligram dosage. They take 1 daily, so they would need to get 30 refilled every month from a retail pharmacy. Click Add Drug and Dosage. The last medication is Synthroid. There's a matching result in the drop-down. And you'll notice that the dosage that is automatically populated is not the actual dosage the client takes. You want to make sure to select the dosage that matches what they indicated, which is 125 micrograms. They take 1 daily, so that means they need 30 every month and refilled from a retail pharmacy. Click Add Drug and Dosage. Now we're getting a notification that a lower cost generic is available for the drug selected. On the drug form, the client indicated they are able to take the generic version, so we're going to go ahead and switch to that because that's going to give the client a lower cost for the remainder of the year. generics are typically much less expensive than brand name drugs. Now that our drug list is complete, I want you to take note that a drug list ID has been created for this list of drugs. You'll want to note the drug list ID number, the password date, which is the date this drug list ID was created originally, and the zip code for your client. On the form we've created, there's a space for you to note this information so you can save and utilize for later if you needed to retrieve this information for future use. Now that you have this information written down, go ahead and click My Drug List is Complete. The next step is going to be selecting the pharmacies. I always recommend to select 2 pharmacies because your client's first choice might not be a preferred pharmacy with the lowest cost option for the plan that matches their needs. And by obtaining prescriptions from a preferred pharmacy, this is going to make sure they are obtaining the lowest copay and coinsurance amounts available for that plan. After you have 2 pharmacies selected, continue to plan results. Now this is going to give you a summary of your search results. For this example, we are interested in finding out the plans available for prescription drugs with original Medicare. Click on the checkbox next to that option and then continue to plan results. When the results first load, original Medicare information is going to be listed at the top at first. You can just disregard this information and continue scrolling down on the page to view the prescription drug plans available. It's automatically going to sort the results by lowest estimated annual retail drug costs. There are other options available in the drop-down for you to view and sort the plans depending on the specific results you're looking for. But most of the time, clients are looking for the lowest cost. So you want to first then look at the estimated annual retail cost because this client indicated they wanted to pick up their prescriptions at the pharmacy. You'll notice it also gives mail order costs just in case they might change their mind or are just curious. The information's always there. The next thing that you want to look at is for their drug coverage to make sure that all the drugs they take are on the formulary. You'll see in this case, the lowest cost option, yes, all of the drugs are on the formulary. The lowest cost option isn't always the best because there are other factors to consider. Your client might be concerned about the star rating of a plan. If you scroll down further, you can see all the results of the plans and their star ratings. If they want a plan with a higher star rating, they might not be concerned with the lower cost because the star rating can correlate to the customer service they'll receive after they are enrolled in the plan. Once you've identified the plan that your client wants to enroll in, you can click on the plan name to find out more detailed information about the cost they're going to incur throughout the year. By clicking on the plan name, it will break out details of the cost information once they're enrolled into the plan. Now that you've selected the plan, you can view the monthly drug plan premium, the annual deductible, and the full cost of the drugs and premium amounts for the remainder of the year. It's going to show the pharmacies you selected as well as the mail order costs, and you can see by going to one pharmacy over another, your client will be able to obtain their prescriptions at a lower cost over another. If you continue scrolling down, it will break out the medications as well as details of what they'll pay for each of these medications during each coverage stage. This is a stage where their cost could vary as opposed to the initial coverage stage they were in throughout the year. They may or may not get into this coverage gap stage throughout the year. So to find that out, if you keep scrolling down, it's going to provide a really nice bar chart that is graphed out in different colors. If you hover over the different colors, it'll tell you what makes up the cost for each month. In the brown is the premium. The orange indicates what they'll pay during the deductible stage. And then in the green, it indicates what they'll pay in the initial coverage stage. This is a graphic way for your client to see what they'll pay throughout the year as they go along into each of the coverage stages. If you keep scrolling down, you'll see additional information about each drug, or the formulary tier the plan has these drugs on, as well as if the drugs have any restrictions. You'll notice that cyclobenzaprine does have a prior authorization restriction and a quantity limit exception. These are two things that you want to check into before enrolling your client into a plan to make sure that it will suit their needs. And if you keep scrolling down further, you're going to see a recap of the information we initially entered to obtain this drug list. If you need to make any changes or edits, you can make those here by clicking on change dose or even removing a medication in case you entered one in error. And that's how you do it. Want more helpful training and tips for videos, articles, and podcast episodes? Visit agentsurvivalguide.com.